Good evening, everyone. My name is Dr. Bruce Ettinger, and I'm the Executive Director of Spectrum 360. I'd like to welcome you to our fourth webinar on housing options for adults on the autism spectrum. And today presenting, we have Mr. Brad Walker, who's with Next for Autism. And he'll be presenting another model of housing that is used to help individuals on the spectrum. And we're also very fortunate and very appreciative. There were so many questions that we were very fortunate to have Lisa Pauls, the attorney, coming back. She has such an expertise on all the rights and all the current laws, some of them more favorable, that individuals need to know to advocate and to secure the best housing options for their adult. And we have Keldrick Wright, the director of Willow, who presented last week, who has he has a number of homes and he has a very interesting family-centered model, and they'll be here to answer questions. Okay, for those of you that weren't on the other webinars, I'll quickly explain what our organization is. Our organization is called Spectrum 360, and our mission is to provide the highest quality educational and therapeutic programs for children with learning, language, social, emotional challenges to achieve their maximum potential as responsible adults in society, and to act as a leader in promoting the following innovative educational programs. We basically serve children on the spectrum and with related disabilities from 3 years of age. Our oldest adult is in the 40s. So we have a wide age range, and we serve the whole spectrum. We have Academy 360, our lower school, which is in Verona. Academy 360, which is our high school, which is in Livingston, and also includes a program for young adults 18 to 21. We have Independence 360 for adults over 21 that has a campus in Livingston and a campus in Whippany. We just doubled our size there, and we're approved by DDD and DVR. We also have a Culinary Academy serving adults, high school and young adults. Actually, we serve some of our students and adults, but we serve from all over, those that come after school on weekends and summer, and they get skills in culinary arts. Similarly, we have a film academy that teaches video editing and production, and it's led to many vocational jobs for a number of our adults. The reason and the purpose of this housing webinar series is that we're committed to provide the information and research to help our community and the outside community navigate the complex residential system and help families to secure the most innovative residential options best suited to meet their future needs. As the number of young adults that we serve and adults increases, since we're not providing residential, we're very committed to providing workshops and resources. And I hope this is just the beginning of many more webinars that we'll be doing. We also appreciate the support of sponsors TD Bank and the Helen and Walter Mintz Foundation, which provides funds that will be able to continue providing these webinars in the future, which are so needed. All our housing, next slide, all our housing webinar series can be found on our website. We have videos of all of them. And I encourage you to let your friends know and to please share it. On October 15th, we're going to have another very important webinar, Securing the Financial Future of Your Loved Ones with Special Needs by Speaker Donald Brown. I've heard many financial advisors, and he really is outstanding. And it's not enough to know what funding sources are available and what options are available. You really need to know how to get your own finances in the proper order with the proper trusts so you can maximize these services. And so it's a very important webinar, and Donald has been doing it for a number of years and is really recognized in the disabled community. So I really encourage you to attend that webinar. All right, we're requesting that you please submit all questions through the Q&A chat room throughout the presentation. I know we already have questions from Keldrick and also from Lisa that, from last week that we're going to be reading, but also you're encouraged if you'd like to frame other questions and put it in the chat room. All right, it's my great pleasure to introduce Mr. Brad Walker. Brad Walker is the Vice President of Community Living Supports at Next for Autism, where he leads the community living efforts, including development and expansion for Next for Neighbors, a program which was created by Next for Autism and CLO in partnership with the ARC of Westchester. He brings expertise in professional family teaching model, a model that provides immersive supports to individuals with autism using family-style living, behavioral and teaching competencies for staff, comprehensive training, crisis intervention strategies, and certification. He's worked with individuals with intellectual and developmental disabilities since 1990 across the US. His professional roles have included direct support, management, behavior consultant, quality assurance administration. He holds a degree in organization and leadership from the Friends University in Wichita, Kansas, and is pursuing graduate studies in applied behavioral analysis at the University of Kansas. Before he presents, I just want to say a word about Next for Autism. They've really been partners with our organization. They've given us a number of grants that help us expand our transition program and our adult program. They've also provided consultative services that have helped us get better at preparing our adults and helping them find jobs. So it's my great pleasure to present Brad Walker.
Hi, thank you, Bruce. It's great to be here. Next for Autism is, always so appreciative of our partner programs and being able to collaborate on services across the country. You can go ahead and advance to the next slide. So as Bruce mentioned, Next for Autism is working to transform the national landscape of services for people with autism by designing, launching, and supporting innovative programs. And as we have been so fortunate to build a network of providers and partners across the country, looking at the work that they're doing and provide support to them, we're so grateful for the work and the good work that they're doing, helping to give greater opportunities for individuals on the spectrum. Next for Autism was created by Eileen Lehner and Laura Slatkin. They are our founders, and our president and co-founder is Eileen, and Laura is the president of our board of directors. And they've worked very hard to bring educators, universities, and philanthropists together, working in areas for clinical education, community, social opportunities, employment opportunities, just again to either find areas where programs are not present and filling that gap, or collaborating with existing partners to expand existing services or create new programs through them. And overall, looking for ways that we are able to improve the quality of life for the individuals and for their families. Go ahead, yes. So a little bit about what my role has been currently. It's kind of evolved from a grant that was given to Next for Autism about 5 years ago through the state of New York to look at the way that we could transform services in New York, offering maybe a new approach to residential services. And that was to bring about a model that is often probably widely known as shared living, that we call the professional family teaching model. That is a model that has been implemented in Kansas for about 30 years. And they're supporting, and shared living are basically up to two individuals with an intellectual disability and autism who select a professional family, and they mutually agree to share a home and to share their common bond, develop a bond, and to build a family home. And the individuals who with an intellectual disability are able to receive supports from that professional family to build a life of their choosing. So for this purpose, we started working with the Arc of Westchester, who are an established program in Westchester, New York, and created two homes as a concept to support individuals who are specifically on the autism spectrum, supporting individuals who have some really high acuity issues with behavioral and health needs, and looking at ways that we are able to fill a gap. Part of that model also incorporates a training mechanism for direct support professionals that layers in an additional week of training onto the 2 traditional weeks that cover things like med administration and crisis training, HIPAA compliance, and bloodborne pathogens. But this last week is specific to the professional family teaching model, which encompasses 10 prescribed outcomes for quality of life measures, and also incorporates autism-specific training for learning, visual supports, environmental structures and work systems, and then also a foundation of applied behavioral analysis training, which kind of takes the typical traditional training of direct support professionals to another level, which gives them, I think, a greater round of resources when they're working on their jobs. It also builds in a piece of certification. So as we go along and implement the model every month in the home, we are evaluating those 10 outcomes by a professionally trained and certified evaluator in the PFTM to see how those outcomes are actually living within the home. So one of the things that I like about that process is that, for instance, I visit the home and conduct, anywhere from maybe a half an hour visit to sometimes longer, a couple of hours, looking at different concepts of choice and control, how much I'm observing that the person who's living in that home really exercises exercises their voice, their ability to make choices about what they want in the home, where they want to relax and what do they want to eat, and how they're really doing what I do in my home, making my menus or making my grocery lists and making my meals. And if I put something that I think I want to eat and change it, then that we're honoring that. That we're also looking at how they're increasing their opportunities for engagement, that it's not about caretaking, custodial care, it's really about teaching, making sure that everyone is involved in every aspect of their life, embracing the idea of nothing about me without me. So if there's laundry to be done, cleaning to be done, yard work to be done, that it's a shared experience between anybody who lives in that home. It's not about the professional family who are paid to be in that home, but to really incorporate everyone's joint efforts and care for the home to make sure that it's successful. That there's opportunities for personal relationships, that we're honoring legal and personal rights, that people have the right to their privacy, to communicate who they want, with whom they want, to have private relationships, to receive their mail, to have all experience and enjoy all the rights that we have. Just making sure that we're not unduly imposing restrictions in someone's life that should not be there. That we're also monitoring and supporting someone in making healthy lifestyle choices, that they're seeing physicians regularly and that their healthcare needs are being met. So that's a large part of that outcome. So as we monitor those every month, the support that are in that home, that professional family, is learning how to monitor those objectives. And then through the course of a year of applying those core competencies, they have to become certified in that model. And that is us just looking that not only is documentation good for the purposes of meeting regulatory compliance, but they really are embodying the spirit of what that model has asked of them in terms of ensuring that people are really living their best life and a life of their choice. So let's see, I'm going down the slide here. This also involves not just the home itself, but also what are the day habilitation choices, and getting into the day service without walls. How are people building those community connections? Where are they developing relationships that are non-paid? Where are they having job and volunteer opportunities? If there are needs around clinical supports, that those are present and the person is accessing all of their supports the way that they would need to ensure that they're receiving the right supports with problem behavior or a serious health condition. And then, again, it's continuing development of that professional team. So you can go ahead. And the theory of change is, I was looking at this, and we had worked on this a while back when we were involved in the grant with the state of New York. And it really is about, kind of looking at what has historically been the problem. And that is that there haven't really been services. I think more and more people are developing some great services for individuals with autism. But, over the course of time, there's been a lot of inefficiencies and insufficient services. And so some of the barriers that we identified are that autism services, individuals with autism are made to fit into the IDD mold, the intellectual and developmental disability mold. That we know that there are differences in the ways that individuals with autism are learning and the way that they engage and develop relationships, and not expecting them to conform to those ideas, and really trying to tailor programs that are going to meet their needs. That the barriers are high cost for skilled professionals to design and manage programs, high cost to train and pay skilled staff to provide the services. There's a high cost to set up and track quality measures. And then often state policy may be limiting, and there may be limiting of new programs and new concepts to approaching those programs, and that existing services are largely underfunded, that there's not been money to help improve pay for direct support professionals, or to expand or change and reduce larger settings into smaller settings where they could be more intimately better served, more than likely, just from being able to tailor the needs more specifically to just a couple of people versus larger settings, and a lot of staff members that are going through those homes. So what Next for Neighbors is attempting to do is to design a program that is tailored to the adults' needs on the autism spectrum, provide funds for the design and creation of proven high quality programs. As I mentioned, we've utilized these model outcomes for 30 years. They were based in research in a collaboration with the University of Kansas. And so there's been a lot of research that has gone on and years of implementation of those outcomes. Provides funds to hire and train skilled staff, adding in that extra week of training, and then the ongoing process of those quality measures allows us to see how the DSPs are performing and how the impact of that service delivery is either hopefully bettering the person's life or where we need to make change. That providing funds to ensure data is collected and used to track progress of individuals in the program. So there are actual tools, and there's the list of 10 of them that are used every month with specific criteria under each. There are scoring criteria as well as summary feedback. We also take into account all of the life plan and ISP goals. If it's medical information, physician's orders, medication records, anything that's going in to substantiate the service delivery components, and then advocate with and provide support for families and providers to push for legislative change. And so one of the things, as I mentioned, this is a concept for New York. We've done it in other states, Kansas, California, Tennessee, Virginia, and being able to take this model with some evidence to the state to encourage that there is room to bring it into more service providers, or to look at ways that we can expand that service delivery following these models and this model in at the Arc of Westchester. So what the service would look like is simply that the adults on the autism spectrum are living their chosen life. And I've said that probably 3 or 4 times since I started, is that it's all about how the person is choosing to live, where they choose to live, whom they choose to live with, things that they want in their life, following their hopes and their dreams, and helping support them to achieve those goals. And that is the last slide, I believe.
So thanks, Brad. So I think one question somebody posed to you directly was from Ellen Spano, who asked, how do you identify those willing to be a professional family?
We've gone through some different search criteria. We advertise like anybody else. We have put it out on Career Builder and Indeed, Monster. I think locally in New York, the Arc Westchester does a majority of the recruitment, and they have secured many of those interested parties from Indeed. It's required, since it's new, quite a bit of education. So once a candidate thinks that they may want to have some conversations about what it would be to be a professional family who is living in with someone with autism, then they pass that to me, and I have more of an in-depth conversation about what that experience might look like. Because as much as it's rewarding, it is very challenging. It does come with different issues at times, from if it's problem behavior that cycles, or somebody goes through a period of not sleeping very well, then it's trying to figure out how we're able to support, or the agency's able to support that. So some of the other areas, there's a national webpage called houseparent.net, and that is kind of more of a central location that I think is known for people who really have chosen a career in live-in services. Most commonly, you'll see from children's residential programs, or where they're living in children's group home, or it's adjudicated youth, and they have lived in those environments. And living in the adult world has been around for quite a while. It's just starting to gain traction. I think the more that there have been challenges with high rates of turnover nationally for our programs with direct support professionals. I believe it's a little over 50% now. And after they have been in the field for a year, they're turning over at the tune of 80%. So it's been really hard to recruit and retain direct support professionals. So moving into the arena of shared living and being able to look at the unique strategies for compensation through contractor payments, where that's allowed, has really afforded also people who've maybe been DSPs for long periods of time to come into roles where they want to dedicate more of their life and make that commitment with living with someone maybe they've worked with for many years. So that is probably the number one best connection that we have, is after somebody has maybe lived in a congregate setting in a group home, and they want to try shared living, they want to move into this unique model, that they already have a built-in connection with someone who would be a wonderful match for a professional family member.
Great. And there was a question about that compensation plan. Is contractor fees the only way that a family can be compensated, or is there other strategies or other ways that happens? Yeah.
Fortunately, I've been around the country a little bit, and so working in Kansas, and where that's where I grew up, actually, is Kansas. And so I worked with Community Living Opportunities, which is now called Good Life Innovations. Seems like people are going through name changes. Next did that a few years ago. We've used, that actually started out as an employee-based hourly rate compensation, and it evolved into contractor stipends. So there was a percentage from the waiver payments that came to Good Life, and they retained a portion for, of course, administrative processing, because they were billing, they were processing those payments, and then they would pay those contractor payments to the providers. And then they also held back some monies to provide the clinical services. So if there was a behavior analyst that was involved, or a nurse, or they used the clinic at CLO, at Good Life Innovations, that'll take me a little while to get used to. Old habits die hard. But, you know, being able to provide those additional add-on services depending on what the individual's needs were. So that's one way to do it. And then in California, we also use contractor payments. I was the operations director there for 7 years. Again, it was a new development. It had been created by CLO in partnership with the regional centers in the Bay Area, San Andreas Regional Center, and we used contractor stipends. In Massachusetts, they have a tiered system. They use contractor payments, but they have escalated those payments depending on where the person sits in need. So they have kind of like a tiered system depending on, for waiver payments, if you really don't have exceptional needs, you might not get the greatest amount of waiver reimbursement. But, you know, depending on, as your needs increase, you might receive the highest of the waiver reimbursement. So conversely, if that person is in a shared living environment, the contractor stipends are escalated as well. In New York, we haven't had the luxury of doing the contractor stipends. There's been some conflicting discussions and theories on whether or not New York's labor laws and standards would actually allow for the contractor payment. So we currently are doing it in an employment model, much like CLO started off, until we can establish more research and have more opinions on whether or not that's felt that we could move to a contractor payment system. So it's really whatever the needs are and what the organization is comfortable with.
Well, what happens when the professional family household changes?
You mean the professional family's needs change and they move, they decide to leave? Then we go back into the process of looking for maybe, again, are there any other connections that are existing between the individual and services, and somebody that they know that would be, again, an easy match? Is there somebody who, or do we need to go back into the recruitment pool and cultivate that from, a non-familiar person, and then start building and cultivating that process? Oftentimes we're engaged in relationships where we're asking for, as much time as possible. If they know that there's going to be a change, or they know that something's needed, can we build in the time to do the search and to start incorporating introductions and doing transitions, which are always difficult. They're never the easiest things to be done. So then, of course, there's other times when there's emergencies. Sometimes the professional family has a sick family member and they have to leave and go take care of them. And so those have been the tougher times, but they do occur. What I will say is that, by and large, compared to what I mentioned in the turnover rates for direct support professionals being, in the 50th percentile, our experience at Good Life Innovations in Kansas, our turnover rate was less than 3%. And I will, and it fits so many variety of people's lifestyles. I always use my mom as an example because, she is, I won't be specific with her age, but she's in her 70s, and she supports two individuals who have autism, and they've had their relationship as a professional family, as a shared living environment, for 8 years. And prior to that, that is that evidence. My mom was a weekend support for the house that supported one of those individuals. And she actually had started off supporting him, and another person lost her professional family, and they were like, Judith, that's my mom's name, would be a great fit with this other person. And so they did some matching and some connecting, and it worked out, and they've been together, like I said, for 8 years. So it's a pretty interesting experience for everyone. And like I said, it gave my mom a wonderful way to earn a living, and she gets to do something that she loves, which is she's always been somebody who's probably fit into the category as a caregiver. And so she's really able to morph that into being a really strong teacher and offer a lot of structure, and gets the reward of building wonderful connections with those individuals and with their families, because everyone is involved. When we call it the family teaching model, we really mean that family environment and that family feel. So it's birthdays and holidays and barbecues and different events that all the families experience, and we all just become one big family.
That's great to hear. So if there is an emergency situation, shortened time frame, is there a queue of families or other direct support professionals that are available and ready to go to take in, so that there's there's no kind of extended period there's no support? Obviously this can't happen. So is that kind of the strategy in case that something does happen?
Right. The idea and the proactive strategy is certainly to do the advertisements and start to build that pool, that portfolio, so that you've got people who you've done some pre-screening and have an idea of who they are and who they might be best suited with, so that as something happens, you can try to make that connection as quickly as possible.
Great. That's very reassuring. So I've heard you mention a few states. You've mentioned Kansas, California, New York. How about New Jersey? How has this been presented? I know there's always complications, but we're a New Jersey-based company, and we have a lot of people interested in hearing about New Jersey and what the challenges have been there.
So I would say that 3 or 4 years ago, I started a folder to consider looking at what New Jersey would be able to afford in an openness to receiving this type of model. And they were undergoing, I think, a transition with some administration and a change within their State Department. I had reached out to a few people and was told that right now that probably wasn't something that they were going to be able to focus on or target. But I know that Next for Autism has an interest in looking at ways that we can expand the program that we're calling this as Next for Neighbors. And so it's the term for our community living program to bring Next for Neighbors into our neighboring states. So if there's an existing provider that wants to look at how they can incorporate this, that's certainly of interest. Next for Autism isn't in the business of delivering the service specifically as much as I am the subject matter expert, as it's called, I suppose, and that I would be able to transplant that intellectual property into those locations or with an existing provider to innovate a little bit differently and see how that would evolve. So
since you've found some success in New York, one of the questions comes, how has it been financially sustainable in New York, particularly with the residents with serious challenges? What have you seen?
This particular house, I think, is presenting quite a few challenges. As when you're developing a new home, you run into different hurdles. And one of the challenges that we're having is that he does have some pretty exceptional needs. And so we are currently have a pretty heavy staffing model in the home that we're working on a fade plan or a shaping plan to reduce that. So far, the early data is looking really positive in terms of his needs, so that we can start to look at what that plan might look like. But I would say one of the things, like in my slide, is that historically the existing funding structures are largely insufficient. You're supporting 1 to 2 individuals in a home, where typically service funds are designed to maximize a collection of 4, 5, or 6, so that you can utilize that weight of that in one location. And we don't have that. So we're using this as a way to conceptualize with the state and how we might do something a little differently. Again, the key structure there too, then another piece with that, the reason why it's expensive is with having an employee-based model versus the contractor model, we're having to put more people in terms of staff through the home, which makes it more expensive in terms of the fringe that pays them, all the benefits that they're getting. So, contractor models, they're treated just as that. So they're not entitled to all of those employee benefits. But what happens when you live in the home as a contractor and you share the home with someone, you're entitled to what is called a difficulty of care tax exemption with the IRS. So the funds that the contractor would receive, they're tax-free, they're tax exempt. Only thing that we would remove, or that we would remove from that, would be their, oh my gosh, it's just gone out of my brain. We would remove their Social Security, so that still gets paid on their behalf. But yeah.
So, you know, obviously with being New Jersey, how can we get something like this started in New Jersey? Is there anything our families and the community can do to advocate for this? What have you found, or is it something you're still exploring to, you know, push this forward?
I think, you know, from a lot of what we've had to do initially is kind of start looking at conceptually what would this look like, and looking at New Jersey's regulations, looking at ways that is there which model or which funding structure and which regulatory structure, because in New York we have something we call certified and non-certified. Non-certified residences are HCBS waivered services typically, and they are more accessible than certified residences, which typically have much stricter criteria to get into. The program that we're utilizing in New York is a certified residence. Again, and we're trying to transition this into a non-certified residence. And the state is more interested in doing that, because typically those non-certified residences also cost less. So we're navigating a lot. I think in New Jersey, we would have to see, look at what is the funding structures and how could we construct it so that it would meet all of the criteria for implementing a shared living model. And then, you know, having conversations with the state to see if they're interested in trying to implement something, and where we would want to, where they could partner. Of course, we wouldn't want to do anything without having a really good state partner who's committed to bringing in something new, and getting their buy-in and their commitment is, I think, key to a successful demonstration or a successful new innovation for a program.
Yeah, great. Thank you for that. So I guess do you anticipate servicing the nonverbal and or behavioral population who require a higher level of support than the average good-hearted person can handle? And I think it's a really good question. I know there's training and all that stuff, but what is your anticipation of that? What is the plan there?
Well, interestingly enough, the home that we opened in August. That young man came from a children's residential school who is nonverbal and has quite the repertoire of behavior. And so we are, you know, really focused on developing and cultivating those DSPs, the direct support professionals. We call them community living support professionals, as a way to, one, put a stamp on it, and to kind of differentiate them. DSPs, you know, I'm a huge advocate of any DSP giving them a greater set of tools and really developing a professional path for them, so that they can feel all of the things that I know that I want to feel in my job, which is, you know, having skill sets and resources and an agency that's behind me, and that I can go home feeling accomplished. And we know how difficult it can be to try to support somebody with some pretty significant problem behavior. So these community living support professionals, as I mentioned in that third week of training, go through an applied behavioral analysis foundations class. They also receive extra supports, extra training in work systems, visual support tools, ways that we're able to better benefit the individual services and how they are learning, and layering in significant communication systems, so that they are able, whatever their learning style, if they're a concrete learner or an abstract learner, if they need 2D or 3D visual supports, that we're creating those, and they are such a key part of what we do. And they support the professional family teaching model outcomes. One of the outcomes is effective communication. That if the person is not able to express their wants and needs, it is the agency's responsibility to ensure that they have an effective means to communicate. That I don't, I go in to evaluate and I don't want to see someone struggling or engaging in problem behavior to get their needs met. I want to try to give them an effective way to say, what it is, I need this, or I don't want that, whatever the choice is, that they have an empowered way to do that.
And that's a good question too. What is your evaluation process? So once you have the DSP in place and you have the placement, how does the Next for Neighbors monitor this? How are they checking in and making sure that someone, especially with nonverbal needs, their needs are being met and their communication skills are being there and everything's being laid out like the way you described?
Okay. So those 10 outcomes that were listed in the slide, we use the professional team at the ARC of Westchester. This was also something new. That we used a clinical team leader to evaluate pleasant, safe environment, pleasant social surroundings, high levels of participation, not legal and personal rights. And we're using a quality improvement team member to do choice and control and legal and personal rights. We're using a nurse to do living healthy lifestyles. We're using the behavior analyst to evaluate effective learning and effective communication strategies. And so what that does is it distributes the quality evaluation metrics across a professional team. And all of those outcomes, I can't stress this enough, all 10 of those outcomes have to be implemented in the home every month. So it is a matter of direct observation and record review. So it's not just about saying, oh, we collected a lot of really great data and it looks like that we implement it. We're actually watching the quality of teaching. We're watching the quality experience of engagement. We're watching where people are going and spending their time and how they're building that network within their community and how they're building and forming those relationships. We're evaluating that home, not only with its safety drills, but it actually presents that it's safe. It's a safe environment. The vehicle is well maintained, that everybody is skilled in crisis intervention protocols, that people understand how not to violate someone's rights, that they know what the reporting processes are, that when somebody's asking for, can I have a glass of milk, that they say, you don't need to ask for a glass of milk. That's your refrigerator. It's your home. It's your milk. Have a glass of milk. But remember, there's other people who might want a glass of milk, so we just don't want to drink it all. So it's paired with rights and responsibility training. So it's a lot that goes into monitoring. And like I said, it's a little bit of a different approach. I kind of come in behind. I'm there every week, actually. I like to do a check-in. It's kind of reliability for that professional team. I know that they're doing a rock star job. I just want to make sure that it's still holding the test to the true quality of what those measures were originated from. And then over the span of time, I personally will conduct those certifications for each one of those team members to become certified in the model at 1 year of employment. So it continues to evolve and go. And then they have to be recertified every year.
Great. That's good to hear. I know a lot of families probably wondering about that. So obviously New Jersey, we're kind of limited here, but New York is a stone's throw away for many of us. Can a New Jersey resident choose to live in a New York home? Is that possible? Is there ways to do that, or are we limited to the state and what we can and can't do?
Yeah, I would say that my initial reaction is going to be that unless that they are a New York native or they move and they establish residency, I don't think that they could access. I don't think a neighboring state can come into the New York system. This young man, his home state was New York, even if he was receiving services out of state. So he was able to come back, and the expectation was the state would serve him. So I don't think that was, I think that there would have to be a residency established for anyone to receive New York state services.
Okay. That's great. Well, I think there's quite a bit of questions, but I want to start opening it up to the rest of the panel. So I'm going to ask a couple more to you specifically, and then just bring it in and we can have a kind of a holistic conversation. One of the questions is, so you become a professional family. Well, what is the respite for that family? What does that look like? Obviously taking on this responsibility. Is there a plan there? Could you kind of delve into that a little bit?
So, it's always a fun conversation because people wonder about that. The professional family candidate certainly wonders about it. Depending on the type of model, the type of structure for the shared living program. For instance, my mom, I'll again use her as an example. She is in a contractor based environment, and they encourage her to use respite, and she really doesn't. She does this. It's her 24 hours a day, 7 days a week. So but she doesn't have a lot of extreme issues for her home. Other individuals who might present, more significant needs with medical or behavioral, we have instituted within those contractor agreements that they would utilize respite workers, and then the interdisciplinary team determines what they think that amount of time should look like weekly, and then the consultants would follow up to make sure that there's utilization of that time. In this model in New York, being an employee model, we are following wage and hour rules for 40 hours a week, not trying to pay a bunch of overtime. Although that is absolutely happening when you're living in a home with someone and you're accessible to the relief staff, those other DSPs who are coming in. So there is time where the person is off, that professional family member is off, and is being able to spend time with, the rest of the family that actually is living in the home. This individual has a wife and 2 daughters that he co-parents. And so the daughters are part of the environment as well. But when he's not necessarily directly responsible for a shift, he goes off sometimes with them to have dinner or go do father-daughter things. So there are opportunities for that.
Okay, let's see, one more question, then we're going to bring the rest on to kind of start talking about a different holistic level. I guess the one question is the model a private pay, DDD, or not-for-profit? And how does the funding of the program work? And how many residents does each household serve? So that's my final question for you before we bring the rest on.
So throughout, we've targeted 1 to 2 individuals per household. We're using waiver dollars. It's supervised IRA dollars. So that's how it's funded. What was the rest of the question? It seemed like it was a big question.
Yeah, it was a big question. How many residents can each household serve?
Okay, and that's the 1 to 2 individuals.
1 to 2 individuals, great. And then, and then how does the funding work? So I think you covered that already.
Yeah.
Great. So Brad, thank you. That was awesome just to go through that. Let me bring in the rest. I'm going to share with everyone. I think most people here if you've attended, you are familiar with obviously Brad, who just spoke, and we have Lisa Parles with us, who was our speaker on the first event, who really dove into all of the laws and regulations and everything around that. And we also have Keldrick Wright, who also has a model, an innovative teaching model, so our innovative model. So if you were able to attend this second webinar, our third webinar, you were able to see him. But I want to bring them all back on. I think there's a lot of information provided over these last few days. I'm just going to end my show and get everyone back on. So Bill, if you don't mind bringing the videos back of Keldrick and Lisa, that would be great. Stop sharing. All right. Okay, let's see if we have everybody. Lisa. All right. So hi everybody, welcome back.
How are you?
We appreciate it. This has been, a really amazing webinar series, and I think for a lot of families has helped guide them. But I think since this has been broken up over 4 weeks, I think a good way to start is, all right, I want to know, I want to develop a residential program for my child. What is the first thing I should do? So Lisa, obviously, I'm going to start with you because there's a lot of regulations and rules and things that we need to know. So, and how do we get there? So Lisa, can you kind of give us some light and guidance on how do I start? Where do I go?
Sure. Okay. So first thing I just want to say that good news for Brad and Next for Autism is that I think if you were to approach New Jersey now, there would not be a bar to your model in New Jersey. We've moved many mountains here in a couple of years. Also, particularly, so that's even in the licensed setting, but particularly in the unlicensed setting through self-directed, I have quite a few families in my practice that are doing a variation of this model with live-in, parent teaching models. So it is available in New Jersey. I think what's a little bit different in terms of what they're doing in New York with the ARC is that it's rather than through PPL and the self-directed model, it's actually through, an agency playing, a more significant role. But it is allowable in New Jersey. So I encourage parents to explore that model. In terms of first steps, so that's been an hour presentation. So I'll do a couple of quick things. One is that you obviously always have to think about your funding stream. So as we talked, and if they go back to my last presentation, we talked about the supports program versus the community care program, because obviously the community care program, which is part of the comprehensive waiver, is going to give you that larger budget, which generally you're going to need to support someone in residential. So you need to have your ducks in a row with that, with respect to getting into the community care program, both from a planning perspective and also to just in terms of dealing, directly with the state in terms of getting into that waiver. In terms of making a decision about what you want, I'm going to encourage people again to 3 sites that we directed them last time, which was the Coalition for Community Choice, Together for Choice, and also in New Jersey Citizens for Choice and DD Housing and Services. You did, Melissa, share that last time. That's still up on your website. And the reason why I direct people to there is that New Jersey, that site we've used to connect families together that are in the planning phases and to communicate ideas. And there's a lot of projects in the works right now. It's very, very exciting times in New Jersey. And under the current administration and under our new statewide transition plan, lots of models are possible now. The other 2 organizations I suggest you look at, because they've been just a great, not only advocacy on a federal level that's brought us some clarity in terms of what the feds will allow, and also too in sharing information where you can actually go on and find out about other projects that exist and projects that are in the works. So it's sort of funding issue, and then in terms of thinking about what model you want, connecting with other parents and looking at other programs. Those would be the 3 things that I'd say to get started.
So, I mean, I saw a lot of models and there are so many different options. So Brad and Keldrick and even Lisa, where do I start? What would be a good way for me to evaluate the model that's right for my child? I know there's a lot of needs that I may have for my child, but what should I do? Where do I go? I mean, because right now there was 3 different model options that were shared with me. So how do I begin this research? How do I start figuring out this on my own? Like, where do I go?
I think that the Coalition for Community Choice through Madison House Foundation is a great resource, because they actually have a project tracker, so you can actually go in and you can learn about programs that are in the works, and they also do periodic profiles of particular programs. Also, Together for Choice does that as well too. They have on their website lots of videos posted that will show you existing programs. Now, both of those national advocacy groups have been particularly interested in and advocates for the Farmstead, the campus, the cluster model, because that is the model that was under attack for so many years. Those states can be stricter than the feds. In New Jersey now is, one of the more permissive states in terms of that model. So you do have to check your state if we have people from other states as well. But New Jersey, we've got some really, really exciting projects in the pipeline now.
How do I find out, using a resource of my network of people who are using these models, getting their feedback on touching base with them just to see how their child is faring, how it's working? Is there a resource available out there like that? Is that what the Facebook page is? That Citizens page, or Keldrick?
Well, people do connect through that page. I'll tell you another New Jersey resource is your family support councils through the state Developmental Disabilities Council. The state has, by region, a number of councils which often do educational seminars. It's also a great networking mechanism as well. So it's a way to meet other parents that are either in programs, and I've also, over the last 2 years, I've seen it used as a way for parents to meet each other that are interested in creating programs as well.
And you said there was a family support council?
Family support councils, right. I think there's 9 in the state. Some of them it's just a single county if it's highly populated, and down south, region could be 3 different counties. But that's a great resource to network and find out not only about existing programs, if you want to talk about parents that are in existing programs, but also to connect with families that have things in the works or in the planning phase.
So Melissa, to add to that quickly, I'll just say that for parents who have young adults or children who are in that age 18 age range, approaching age 21, it's a good idea to start investigating and doing research and actually touring places while they have that few years before they turn 21. And upon doing that, they'll go to different places and see different models, and based upon that information that they gather, they'll be able to figure out kind of what would be the best approach for supporting their loved one. And in doing so, they'll probably come across Willow as one of their options. But there's lots of other really great programs that I've learned through being a part of the housing conference with you guys that they should all check out, because not every program is, a cookie cutter recipe for every single family need. So, and as you asked about families and how we are not a part of any particular database, for instance, but when I have a family who comes around for tours, a part of what I do is give them, if they're interested in learning more about us from a parent perspective, I give them a directory with permission from my families for those who need a parent perspective of how their experiences are with having their loved one be a part of our program. And so they get one-to-one information, and they literally have pretty much full range of all of our families who are willing to give them their personal experience. So that's one of the best tools for us to give information to families, is to talk to them directly.
That's great to hear. I know that I would want that too. Brad, I mean, have you, since, New Jersey doesn't have this, are you open to show virtually for different, if New York, or if someone's exploring to a different state right now? Obviously New Jersey is not an option, but as Lisa said, it could be an option pretty soon.
Yeah, and I think New Jersey does have some versions of that. Definitely through the self-directed model, families are doing it, where they have family teaching models in. And also there are some agencies that, even through agency hires to self-directed, maybe not identical to, what Brad is describing, but I have seen where it's a family living in the unit, and there is, part of the, care is part of obviously the exchange for the housing and the like. And some of them are very intensively supervised and trained, and pieces I've seen some interesting things to do. In New Jersey, we have a new position that's just been created in the last year called a support broker, which that's also a great resource. I think that when so we had support coordinators that help you find programs, but support brokers can actually help you create programs through both self-directed through an agency, or self-directed through self-directed employees, individual hires too. So we're seeing more and more things come online with that model.
That's great.
And if anyone is interested in New Jersey specifically, if that model is present, I can tell you that it is, because I'm currently a live-in myself. So I started Willow in 2016 with 2 young men whose families I've worked with privately. And over the years, they both wanted the same thing, which is for their young adults to come and live with me, and I take care of them for the rest of their, into later years. And so, and that was the premise of me starting Willow. And so 6 years later, still live with a young man with autism and one with Down syndrome, along with my husband and a 5-year-old son. And we're all here, one big happy family. And the challenge was seeing how we can duplicate the model. And a year later, we started the Girls House. And so there's a young lady who lives there with her 13-year-old daughter. And she has 3 young ladies who live in the home with them. And then, and that has now progressed to 7 homes in 6 years of us doing the family model. So it is happening, and we're doing it. And we've had a pretty good success rate, with, keeping staff and having our residents fully supported all the way from transportation down to medical appointments and taking some people in the morning, so blood work. And just really the full spectrum of their care and life needs. And that involves a huge partnership with their families to give us the tools to best support them in a way that they envisioned from the time that they were kids, and so we work together. It is a partnership, and we strive to kind of meet all their goals and learn and grow together along the way. So yeah.
Great. It's great to hear. So I think a big question too for everyone is financially, financial planning. And I know this is none of us are financial planners here, but what is your recommendation in your opinion on how should we start planning for this? Like, should we reach out, obviously you said a support broker, but what is the financial plan that should we, Lisa, I know you mentioned the first one, getting in touch with, making sure you're DDD and getting applied onto these. Where do we start? So make sure that we're financially ready for whatever commitment we make or whatever model we choose to go forward with.
Right. So when we're looking at housing or residential, you're looking at a couple different pieces, right? So I know last week when you had Shah and Tom Toronto talk, they were talking more about the financing, the dollars that are available, which are also really loosening up in New Jersey now in order to actually build the project, whether it's build an individual house or build apartments as part of a complex, or even in some cases build cluster homes. So that's, one piece of funding that I would urge people to go back and rewatch that video, because that was really a terrific presentation. The second issue is that what do you need to do planning so you can tap your budgets? I mean, in New Jersey, getting on the waiver is the challenge, but when you get on the waiver, compared to other states, we have very robust funding for residential. And for high need people, if you're looking at high needs, medical or severe behavioral, they're in the $400,000 range. I mean, we have significant dollars committed to the high need population as well. So the key on that is that you got to be Medicaid eligible. You can't be in DDD. So you need a trust in the state's attorney to make sure that the person is, make sure they meet the needs requirement. And that, so that way you'll be able to get on the Medicaid, which will let you into the DDD system. And then there's the third piece, which, I do a presentation which is on, looking at like key questions to ask when you're looking at a program. And one piece of it that I talk to parents about is that, this is not scientific. So the database behavior analyst, I have to tell you, is not research-based. This is just visiting 17 states, over many, many years and having hundreds of parents in different programs, is that the programs that tend to be with the greatest satisfaction, the highest quality, or where families are very much involved in the heart and soul of the organization. So they're not just sitting on the fundraising committee, they're sitting on the human rights committee, they're sitting on the planning committee for where you're going forward. Those are the organizations that tend to be the healthiest and I think the best communication that goes on. So even though I make that point, I will also tell you though, in order to do it really, really well, the really, really quality programs, there is a fundraising piece. So parents need to know that, you wouldn't just drop your child off at public housing and think that that's going to do it. In order to have all these other pieces, which is enrichment and database programs and accountability and training, it takes a lot. So that's a piece that many of you that are in some of the really good private schools, you've encountered that as well. So I think planning again is connecting either with families that want to start new organizations or going to existing organizations with that spirit, that drive, that willingness to, we're going to build the better mousetrap, and then obviously thousands will come as we're seeing it.
That's very good. That's good advice. Thank you.
Mm-hmm.
So another question, at this point, regional, you mentioned the family support councils and the other resources. Is there any conferences or annual events that happen, granted right now in COVID times, but where we can kind of gather together, a lot of these people can talk and share stories rather than just through a Facebook page? Are you aware of anything that is being planned this year that you've kind of come across that you think is a really good resource to share with our community today?
Well, Autism New Jersey, at their transition conference that they usually do in February, they often have presenters on existing models. And they also too, and I don't know what we're going to do this year, because obviously we'll probably be remote tables some way, but often you'll have, obviously providers or even parent groups that, are there. I've seen people connect at that. That's a really strong conference. And the transition one tends to be families of older children that are thinking about housing than the annual one. The annual one's a very good conference. That's next week, if anyone is interested in.
Oh, it's next week. Okay, great.
Yeah, Autism New Jersey, the 15th and 16th next
Okay,
week.
so I'll make sure I'll send that out to our community for that. Thank you. That's a great resource. So I'm looking at, there doesn't seem to be that many questions. There were so many that we had answered in the previous sessions. So I guess I'm going to leave off comments. So Lisa, I'll start with you. So any other sage advice that you can give to our family?
Yeah, I actually have something really, excited to report that actually happened today.
Breaking news. I like breaking news.
Yeah, so today we had again, I'm going to urge you, go back, Together for Choice, Coalition for Community Choice, and that New Jersey Facebook page. They're all free. And Together for Choice, which has been just an amazing group in terms of advocating on the federal level, because we had so much confusion where everyone was saying, oh, the feds won't let us do that. I think we really cleaned that up and clarified that. Today, we actually had a national call with Melissa Harris from CMS, and really talked about some of the, sort of persistent questions that were hanging around. It was so encouraging to hear that CMS position is that projects are not automatically disqualified, that, if it's a farmstead, it's possible. It's if a cluster, if it's a campus, which is a lot of reasons why families are seeking those models so desperately. And a lot of providers find it works well, even if it's just a small cluster, because things in terms of sharing events, sharing staff, sharing supervision. But today, a couple things. One is that the federal review of the existing projects got extended again. So now it's to March 2023. So that's good. That gives states more times and providers more times. And the other issue is that they really narrowed the type of projects that are going to have to go up to federal review. So that puts a lot of power in the state. So what I'm going to recommend for people is that even though New Jersey, we're in a really good place now, and if you have project ideas, bring them to the state. I really do see, as I said, an openness and some really exciting projects coming down the pipe. But in addition to that we do need to continue to make sure that we're advocating, because we need to make sure that process, that the state recognizes and knows that they don't have to go for federal review for all types of projects. There's some things that will automatically trigger a federal review called heightened scrutiny. That's if it's a project on the grounds of an ICF or on the grounds, of a developmental center. Those you're going to have to. But CMS has really clarified that this giving the state a lot of leeway to make those judgments at a state level. So that was, I know this is probably a technical sort of complex subject that I'm introducing, but I guess the point I want everyone to take is that we're really, really excited. And it was absolutely 100% based on an amazing coalition of agency advocates and families that made that needle move.
That's amazing news. Thank you for sharing that. I'm sure there's many families on here that are very excited to hear that. So Keldrick, for you, what is some advice that you could give some of our family members and community before we sign off tonight?
Sure. I'll just follow first of all, thank you, Lisa and Brad and Melissa, Bruce, everybody, for really the great information. It's been really well. And I hope everyone got to take away something really meaningful from all of the information. And I guess the one thing I can, just provide, hopefully, is just hope, just tell families that, regardless of what level of need your particular loved one has, that there is a place for him or her out here in the world. And as discouraging as it may be sometimes, there is always a place, and there's always a way to make it happen. And there's always, sometimes it takes a little bit more homework and research and trial and error. But just to keep digging for information, keep going to these type conferences that 360 is holding tonight, just keep putting one foot in front of the other. And there's always a path to where you're supposed to be. And my other recommendation is that just because I've seen it firsthand, where families have waited until they're, in their 80s, and they're really, don't have the capacity or the wherewithal as they used to have to kind of now put the wheels in motion. As difficult as it may be for some parents to let their young adults leave the nest and to step out there, and trust is a big issue. You have to be able to trust the people that you're, entrusting your loved one to. But I would suggest that, that they just start the process sooner than later and not wait until the last moment, to try to work out housing. So just, start practicing, researching and doing what you have to do now, if you can. Yeah.
Great. That's really good advice. And Brad, I'll leave it with you, and then we'll bring on Bruce to say his farewell tonight.
Again, I want to say thank you for having me and being able to I love listening to Lisa and Keldrick. I was taking a bunch of notes just because it was super helpful. I want to come and visit. I would love to, I'll probably schedule something offline with both of you. I'd love to see what you're doing, and love to explore more about New Jersey. For me, so much time and, being able to be in the field and support so many different individuals over 30 years, the number one thing that I always want to encourage is that that they're making their choices, that they're really at the central focus of what they want. And if it's not something, if something that you are looking for isn't out there, then create it. I loved Lisa driving home the points that there's so many opportunities in New Jersey right now that are popping up, and there's ways to expand it. And if you don't know how to do that, take an innovative idea to somebody, to an existing organization, that has a great reputation for services that, but maybe just doesn't have the right model for your son or daughter. Make sure that you can maybe help them create a new concept. I think, if you can think it, that's how our whole system was built. From state to state, I have learned from people, parents who cornered legislators in elevators and forced them to create something new, that they wanted something that wasn't there. And our system has really developed and evolved in great ways because of parents and those voices. And so I just encourage you to continue to champion that voice, and to push your providers to look for, good ways to ensure quality, that not accepting the status quo. People hanging out doing puzzles all day is not engagement. It's, trust your gut, what you're looking for, and advocate and make sure that those providers are living up to your expectations for your child's growth. I think that those are the big things for me when I go in. I want to see people being really successful and living a meaningful life and having real experiences, and that they have connections and relationships.
That's great. Well, thank you, each and every one of you tonight. You have been wonderful as always, and wonderful the first time and the second time. And Brad, we hope to have you on again in the future. But I'm going to let Bruce kind of take us out on the end of this evening. Thank you to the community that has engaged with us. You've been amazing. So Bruce, what are some final words you'd like to share as we close out?
First of all, I want to thank you, Melissa Cooper, for helping put this together, and our consultant, Brenda Considine, who's a dear friend and helped put this together as well. I just want to recognize them. And I want to thank all of you. I know how busy you are, but I appreciate your passion and your caring. And I want to share something personal in ending. I got interested in the field in the 1960s. I was a student at Yeshiva University, and I was taking psychology courses, and I had a professor who was in charge of clinical services at Willowbrook in Staten Island, And I happened to have a family member there who I started visiting, and I spent time with him. And it was so appalling what I saw, and the lack of creativities and day programs, the way they treated them. I started in college challenging him about innovation and stuff. He gave me a very poor grade, but I mean, that was the start. And it's so exciting so many years later to see how far we've come and how it's possible to be creative and to be innovative. And that's what you're all doing. And I really appreciate it so much. And we have so many, as the number of adults on the spectrum rises, we have so many more challenges to have more models. And I appreciate all of you with your passion and caring and commitment and dreaming and being innovative. And you know, I also want to add, I think advocacy is so important. Right now, I'm heading a group that, you know, with DDD, we're not getting enough funding. So I got together all the people we're chipping in, and we're challenging the state and CMS. And I think we'll make changes. I also got involved on a national level now that we're trying to make legislators. It's nice that there's the CARES Act, but we need more money to start programs. And I guess I'm learning it's a good climate now to advocate and to dream for what's right for children and adults. And, you know, I think there's lots of opportunities, but it really takes people like all of you. And I want to thank you from the bottom of my heart, you know, for sharing your knowledge and expertise.
Well, I like to say thank you to Bruce too, who for so many years has really been such a leader and a light and an inspiration to so many of us. And we're not really going to let you retire.
Yeah, for those of you who don't know,
I'm going to read
Bruce is retiring in December 31st. So this is his swan song.
But we know where to find him now.
I'm starting a new chapter. I'm redefining myself.
It's gonna be the one in the elevator, getting in front of all the legislators. Well, thank you, everybody.
Thank you.
And I think that's everything. So thanks again, and I'll be sending an email out with a lot of these links and all the things that we talked about tonight. So I appreciate your time and have a wonderful evening.
Thank you.
Great. Thank you so much.
Thank you, Brad. Thank you.
Bye.